There we go. All right, so we have 3 speakers. I'm going to introduce each of them up front, or I'll introduce you guys before each of your talks. Let's do that. So our first speaker is Sonia Warga, who is the clinical director from Marymound, located in Winnipeg, Manitoba. She completed her Master of Marriage and Family Therapy in 2016 and started working at Marymound as a clinician and therapist shortly after. She worked as a clinician for 2 community groups at homes initially that provided care for children between 8 and 12 years of age. And after a couple of years, Sonia began working half-time in the sexual abuse treatment program with clients between 4 and 18 years of age. And in November 2020, she took on the role as the clinical director for the organization. So thank you very much, Sonia, for being here, and I'll hand it over to you.
Great, thank you. It's so nice to see you all. So I will share my screen, hopefully. Sometimes me and tech, we're not always friends. So Kara, let me know if it's all good. Excuse me. All right.
Oh, we're seeing your presenter view now.
Oh, are you? Okay, hang on then. Let's try that again. I was all ready. We tested. Is that correct now, Kara? Okay.
Looks good.
Thank you. Sorry, I've changed my view so that I can see all of my notes. So I now can't see you folks. So sorry about that. Now I've lost my mouse. Why is it doing that? All right. So, like I was saying, thank you. And it's so nice to see you all. So my name is Sonia Warga, and I am the clinical director for Marymound in Winnipeg, Manitoba. I would like to start by acknowledging the land that I'm working and living on. Marymound is located on Treaty 1 land, and we believe it's important to acknowledge that we are on the ancestral lands of the Anishinaabe, Innu, and Dakota Ute peoples. The land on which we now work and live is land which the First Nations of this area agreed to share through Treaty Number 1 in 1871. We acknowledge the 7 First Nations for their generosity. We also acknowledge that this land is the birthplace and homeland of the Métis Nation. So at Marymound, the majority of the youth that we are serving are involved in the child welfare system. While we offer a variety of services, a significant part of our work is to provide placement for these children and youth, often when other living arrangements have broken down due to challenging behaviors and struggles in various settings. As much as possible, we work to include family and to foster relationships that are meaningful to the child. This may be through facilitating visits, doing family therapy, or helping to build relationships within the community. Currently, we're looking at the possibility of shifting the focus of some of our long-term treatment foster care homes to reunification homes as well. So since 1911, Marymound has served over 80,000 youth and families, primarily from Manitoba, in a variety of educational, therapeutic, and live-in programs. In 1911, Judge Daly of the Manitoba Juvenile Court requested the Sisters of the Good Shepherd, our founders, to come to Winnipeg to work with young women. So essentially, Marymound was established as an alternative to the justice system for marginalized girls and young women. From this history grew a set of values that guides how we work with youth, family, community, and each other. Courage, compassion, collaboration, respect, and spirituality. Today, Marymound has grown into an organization with multiple facilities across Winnipeg and in Thompson, Manitoba, in the north of Manitoba, serving 2,000 to 3,000 young people, male and female, and their families annually. While Marymound was not part of the Indian residential school system, it was a part of a larger system that participated in the displacement and oppression of Indigenous peoples. Today, we work really, really hard to acknowledge this role, and we're committed to working towards reconciliation in meaningful ways. The Truth and Reconciliation Commission has issued 94 specific calls to action, and some of these are very relevant and important to the work that we do. So our calls to action 10, 22, 57, 62, and 63 specifically recommend that the healthcare system recognizes the value of Indigenous healing practices and coordination and involvement with elders and healers in the treatment of our Indigenous patients as their language, but in our language, our clients and our youth. And so to this end, Marymound strives to meet the physical, emotional, spiritual, and social needs of our clients. We are growing a healing framework rooted in a two-eyed seeing approach, where Indigenous and Western healing are equally valued and respected. To this end, we have a cultural services department established, and that we work very hard. One of my colleagues, Don Isaac, works very, very hard to grow and expand. This department offers the guidance and mentorship to ensure that Indigenous spirituality and cultural identity are integral components of healing for children at Marymound. Excuse me. The team carries out these responsibilities through traditional ceremonies, teaching groups, individual visits, consultation, and collaboration with other staff. We have an elder in residence, a land-based coordinator, and an Indigenous cultural coordinator or coordinators, depending on the time. And actually, I was mentioning to Kara earlier when I first came on that myself and my executive director, who may be on the call as well, were out building the sweat lodge with other members of our organization, and our elder will be having a sweat ceremony later this afternoon. So alongside the cultural services and cultural healing components, we have our Western therapeutic approaches, trauma responsive care, which probably many of us are, or all of us may be familiar with, the presence model, and also the neurosequential model of therapeutics, which is Dr. Bruce Perry's work. In terms of trauma responsive care, like I said, I think most of us are familiar with what that is and the basics of how trauma can affect behavior and responses in various settings and circumstances. Being trauma responsive is the next step, about walking the walk, not just talking the talk. As we've discovered, to know what it is to be trauma informed and to actually be able to consistently embody that are two different things. And so we really strive to bring that forward. Being trauma responsive is something that for us specifically came out of the presence model, which is developed by Dr. Sandra Bloom, and is essentially the next iteration of the sanctuary model, which some of you may be familiar with. In a nutshell, when I'm talking about presence, I like to say it's really a way of being with one another and working together, whether that's at an organizational level or with our clients or with one another. And then finally, the neurosequential model of therapeutics, which is essentially a clinical approach to problem solving that really helps to identify where to begin with therapeutic interventions. So many of our youth come to us with significant developmental trauma. You could spend years attempting to do therapy and to attempt healing, but if you start in the wrong place, it's never going to progress the way that it's hoped for. So the NMT doesn't replace other modalities, but rather informs treatment planning so that that planning is as effective as possible. Essentially, our goal is to help our young people nurture their inherent strengths and to foster a stronger sense of self and improved ability to face adversity. One of the core components of our clinical framework is the hope, purpose, meaning, and belonging. And we really try to live by those and create healing plans around those ideas. So today, due to increasing demand, this slide actually says 2,000. Since updated, as in my earlier information, it's probably closer to 3,000 young people annually. We provide a variety of services at Marymound, anything from crisis stabilization, assessment. We have community group homes. The sexual abuse treatment program was mentioned earlier. Also, we have our own school where these school divisions of the city frequently refer students who are exhibiting behaviors or struggles that are beyond the capacity of the public system to work with. And then we have our independent options program, young parents program, and the futures program. In terms of challenges and future directions for our organization, challenges, minimal to no increase in funding for community group homes or our school and education services. I believe I was in a meeting recently where it was stated that it has been somewhere in the range of 20 years since we've had increases for our education funding. Staff recruitment and retention, very difficult, again, related to the fact that in Manitoba, we've had no ability to increase the wages of our frontline folks for quite some time. And then combined with the pandemic, I think something a lot of organizations are experiencing is that difficulty with recruitment and retention. The complexity of the youth and families we serve is growing for many, many reasons. But I think part of the reason we see such complexity is because the kids who used to come to us are now, they're working more towards reunification or they're in different types of placements. And so the kids who require us and require our care are the most complex youth in our province. And another problem we run into is just a lack of residential addictions facilities for youth. And so we have a lot of referrals with really significant addiction involvement. And so we're trying to do that work, even though we're not really specifically geared in that direction. Future directions, we really hope to expand into some outpatient services, which would also help to diversify our funding and the money that we can access for the variety of initiatives that we hope to implement. We're involved in a youth justice social impact bond, which will divert youth from the justice system into a healing program. And hopefully greater community presence and community partnerships, which is part of why this is such a great fit for us. So why attach? It's congruent with our clinical models, so congruent with our values. It's community minded, which is a place where we are, but also hope to grow in. And it's a tangible skill with a limited time commitment for clients. So where does attach fit for Marymound? Some of the most obvious spots our Futures program, which is in Thompson, Manitoba. This is a community-based program that provides lots of programming for families with young children. And this is everything from parenting classes to school readiness. They have a program called Baby Think It Over. They've got one going on right now called Caring Dads. And I think the other one, My Tween and Me. There's just a variety. They're a great group of folks up there and really just running an exceptional family resource center with all sorts of programming. And just a stellar example of how we as organizations can get more and more involved and present in the community. And then the other FIT, our Young Parents Program, which is actually located in Winnipeg. This is attached to our Independent Options Program and provides help, advice, guidance, and support to young parents actually in the home. So this is a spot where we really hope to employ Attach as those possibilities come forward. And then finally, we are looking at possible partnerships with other community agencies where Attach might be beneficial. We're actually having a meeting next week with a group in our community that runs essentially a childcare center. And the director was beyond excited to talk about this possibility. So that's Marymound. Thank you very much. I'm going to stop sharing and see if there are any questions.
There we go. Thank you very much, Sonia. That was awesome. We have a question in the chat already. So hello, this is from Angela Solsby. Hello and thank you for sharing. When you say our Indigenous patients, do you mean Indigenous patients within Marymound? I wanted to point out that using the word our suggests ownership and this needs to change. We are no one's property.
Yes, you know what, that I apologize for that phrasing. That's not a phrase that I wrote, but rather a phrase that was taken out of the calls to action specifically related to health. Thank you, much appreciated.
Yeah. And I have a question as well, if I may, because I can just. One of the things that I've been thinking more about, and blows my mind, you have so many clients that come through, they're so diverse, they have so many different needs. How do you start capturing metrics of success? Like, do you guys, what do you guys think of when you're looking at metrics and like, oh, we're doing good here, we need to, yeah.
Yeah, you know, this is something that we're really in the process of revamping currently. Previously, some of the things that we were tracking to determine progress were our statistics around kids being on the run, suicide ideation, self-harm, different things around those types, aggression, assault, those types of things that we were measuring in terms of trying to determine whether we were making progress relationally and in a regulatory fashion. So in advancing self-regulation. Currently, we're really in the process of revamping our whole clinical framework and talking more about metrics. So some of the pieces that are critical to that are cultural identity, the hope, purpose, meaning, belonging. We have some measures that are coming out of the NMT, like current relational health, which has been shown to be a really good long-term predictor for better outcomes. And so as we develop our documentation around the clinical framework, we're also developing new metrics. And those are some of the things that we'll be looking at to try and measure how well we're doing for the people we're serving.
Thank you. And I'm related to that one because I can be a hog. Do you also have opportunities to follow your clients over time? Because I know that like there's the short-term outcomes when they're leaving a program, but then there's also the question of long-term outcomes. Are you able to do that, or what are some of the challenges there?
I'm sorry, could you say that again?
Sorry about that. So are you able to follow your clients long-term? Because there's like the short-term outcomes when they immediately leave the program, but then of course we're interested in, Yeah,
I would say generally, at least to this point, we really haven't had the capacity to follow our clients long-term. We have a variety of lengths of time that folks are with us. We have some shorter term, 6 to 9 month programs. We also have youth living in our community homes who may be there 2 or 3 years. So we get a bit of a range in that way. But what I personally find anyways, working with Child and Family Services, there's a tendency once a youth is through our program or discharged from a home to really, for want of a better phrase, abruptly sever those relationships. And so as a result, we haven't followed long term, but I certainly would like to. But just as a sort of a qualitative thought, though, we have many youth who come back after they've left a home or left one of our groups, and just honestly knock on the door. I can think of a very particular home where this youth into his teens would come back and knock on the door and just say, like, hey, is so and so here? And she would be there and come in, and we're making sandwiches and having a catch-up talk. So that's a more qualitative piece, but something that I think really reflects on the work that we're trying to do.
For one more, Janine just going to finish the slide. One more question from the chat. Also wondering about how many families attain service in the chat disappeared, young parents program, like in a given year.
Yeah, it's quite small. Our independent options program, I'm terrible with numbers. I'm going to say they have probably 80 to 100 clients. It might be higher than that, but in the young parents program itself tends to be quite limited. So we may only see, 3 to 5 moms or parents with young ones in our program there.
Awesome. Thank you very much, Sonia.
Thank you,
There
everyone.
might be more questions at the end. Would you feel comfortable posting an email or something that people, because you're not going to be here towards the end, so if there's more questions.
Yeah, absolutely.
Yeah.
Please, any questions that you've got, I'd be more than pleased to try and answer them.
All right, I'll pop your email address into the chat then, so they can contact you there. So thank you again.
Thank you.
We're going, thanks again. Yeah, we're going to jump over to Janine Ballman, and I'm just going to, so Janine is the Executive Director of Family Service Saskatoon since January of 2018. She has extensive management experience and has held various leadership roles throughout her career in the nonprofit sector. Janine obtained her Master of Arts degree from the University of Calgary and her bachelor degree from the University of Saskatchewan. And she has spent her career committed to work that promotes inclusion, caring, and compassion. Janine is honored to work in an agency that provides services to support people on their path to well-being and in fostering healthy relationships. She is passionate about developing services to meet the needs of the community and looks forward to continuing this work in her current role. And in her downtime, Janine enjoys relaxing with her family, reading, spending time with her friends, and traveling. Yeah. So thank you very much, Janine, and I'm going to hand it over to you.
Super. Thanks, everyone. Yes, well, as Kara said, I'm the Executive Director with Family Service Saskatoon, and we work towards strengthening people, nurturing relationships, and building communities. So a little bit about us. We were founded in 1931, so we've been around for 90 years. We are accredited with the Canadian Centre for Accreditation, so that is an independent third party that once every 4 years, we go through an extensive accreditation process where they review our governance structure, our governance policies, as well as our policies and our work that we do with clients. We are really considered a family service organization, hence our name. And so we really are a community-based organization that provides counseling and then various programs related to intimate partner violence, family violence, hoping to help come up with ways to reduce and prevent that. And then we do things in the area of parenting as well. And I'll get into some of that in a little bit in more detail. So we are a nonprofit organization governed by a volunteer board of directors. We are also a registered charity, and we get our funding from government, social enterprise, and private philanthropy. We are located on Treaty 6 territory, which is the ancestral and traditional territory of many different First Nations and the homeland of the Métis. And we are working towards truth and reconciliation as well. We truly believe that we want, that we need to work on this to reaffirm our commitment and dedication to relationships with one another, with Indigenous people who have been part of this territory since the beginning, of course. So what our mission statement is that we serve individuals, families, and the community to nurture safe, healthy, and respectful relationships. Unfortunately, Saskatchewan has the dubious distinction of having one of the highest rates of domestic violence in Canada, as well as family violence. And so we really, a lot of our work is in that area. Our vision is healthy individuals and families contributing to a strong community. So who do we serve? We serve individuals, couples, families, children, youth, and the community. We try to ensure that our programs are as barrier-free as they can be. So vast majority of our programming is at no cost. For those that do have a cost, we use a sliding scale to ensure that it remains affordable. We have some subsidies in place. And then we do also offer an employee family assistance program, which is where employers will pay for counseling services for their employees. So again, we're trying to make it as accessible as possible. And we are counselors, we are social workers, we are marriage and family therapists, we are youth workers, child care workers, and administrators. So as I mentioned, we have services to strengthen family. We have services that we hope will help to address violence and abuse. We provide parenting support. We respond to the needs of youth at risk. And as I mentioned, we provide employee family assistance program services. So we are a business member of Family Services Employee Assistance Program, FSEAP, which is a national nonprofit of agencies like ours to provide EFAPs across the country. And that's where we are contract with a variety of different employers to offer that. And that is also, we then can use the revenue from that service to go back to support and to help subsidize some of our other programming. So our programs include counseling, and like I mentioned, that includes EFAP. We are a fairly small nonprofit. So last year, I would say we served about 3,100 people. Out of that, we did over 5,000 hours of counseling. So that is a lot of the work that we do. We also provide something called rapid access counseling clinics. We are part of a provincial network where we offer these. A lot of it is done virtually. That is because of COVID, but when it's not done virtually, we go out to different locations in the community. For instance, the library or other local organizations out Saskatoon, Prairie Harm Reduction, those types of things. And we provide counseling at those different locations throughout our city, and then throughout other agencies we cover it, so it's throughout the province. And last year, our organization, we provided 800 hours of rapid access counseling clinics. Domestic violence court caseworkers, Saskatoon has a domestic violence court. Our caseworkers are there to support those who have experienced violence, and they have the perpetrator has been charged, and their case is going through a special court called domestic violence court. And so our caseworkers are there to support the victim. They're also there to provide ODERA assessments to the court, to give recommendations on whether or not any of the no contact orders should be lifted, or whether they should be put in place, those types of things. So they provided support to 969 individuals last year. We also then have an intimate partner violence outreach team, and they work with anyone who has experienced intimate partner violence. It doesn't have to be someone who has gone through that court. So the person doesn't have to be formally charged or anything. Sorry, the perpetrator, not that we work with the individuals who have experienced intimate partner violence. So we provide counseling support, we provide groups, we provide outreach with that. And so they did 695 counseling hours last year. And then we have programming for youth. And this is, I'll get to how ATTACH fits in, but we have our teen and young parent counseling program. We have a youth exposed to violence counselor. We have child and youth supports, and we have promoting youth resilience, which we call 52 North. So last year, all of those services provided hundreds of hours of counseling, and we provided services to hundreds of youth. Other things that we do is we have different groups. So we do have we actually don't call them, we call them intimate partner violence drop-in groups. We have other groups that talk about abuse and beyond and invisible scars. So for us, it's important that we're meeting clients where they're at, and that, like I said, it's not that there has to be a formal charge of domestic violence or anything like that. So we meet the clients where we're at. We very much take a trauma-informed approach, and we have regular drop-in groups for those who want to attend if they have experienced some type of intimate partner violence. Our abuse and beyond and invisible scars are for, it doesn't have to just be physical violence, it's any type of abuse. And so whether it's being emotional, those types of things. So we have some programming around that. We also work with the perpetrators, and that's through the Men's Narrative Program to foster respectful relationships. So those are individuals who have been charged, and they go through this program. Again, we're hoping that it results in healthier relationships going forward. We do groups on anger management, whether that is for youth, whether it's for parents, whether it's just a general anger management. We provide groups on wellness, mental health, resiliency. We do a lot of groups on healthy relationships, parenting supports, and we have done some groups on intergenerational trauma with high schools here in the city. So how does ATTACH fit in? This will be another tool for our counselor to use with parents. Our teen and young parent counselor is the one who has taken the ATTACH training, and we are excited. She's just in the process now. She's passed everything, and she's just in the process of recruiting individuals. And so in the work we do, we work with many individuals who have experienced trauma, and so mainly for that reason, and many others, but it was mainly that we thought this would be a great resource, just another tool, another skill for those parents to build confidence in their parenting skills. And then research and program evaluation are important components of our, so it fit nicely for that reason as well. We are accredited, as I mentioned, by a national body, and part of that requires that we have continuous quality improvement initiatives. And so the work being done with ATTACH will help us on that front as well. We are very much involved in our community. This gives you an idea of different partnerships that we have. A lot of them are related to, like I said, helping to prevent family violence, but we're also involved, of course, in various other things, Reconciliation Saskatoon, Prairie Prism, which is with, it's once every 2 years we bring together different organizations to highlight different cultures, those types of things. So very briefly, that is Family Service Saskatoon. If there are any questions, I would be happy to answer them.
There we go. Thanks. Another wonderful talk. Just jumping into the chat here to see if there's any questions. Well, while we're waiting for questions to come in, you can either raise your hand or put them in the chat. I'm going to ask you the same question again. How do you, again, with such a complex, so many complex issues, complex clients, how do you, what are your metrics? Like, what do you think about in terms of metrics of success?
So we do a couple of different things. We make sure that we get feedback from our clients. And so we do that in a number of different ways. We do regular client satisfaction surveys, which we certainly rely on. And then we also use, it's something called, it's called PCOMs, Partners for Change Outcomes Measures. So this is something that was developed sort of for the health services counseling field. And there's a session rating scale and an outcomes rating scale, and we use that. It is a tool that over time helps to assess whether or not change is likely to happen, like permanent change with clients. There, of course, with any scale or any of these measures, there are pros and cons to it, but that's one of the main things we use. With our youth, we actually, we have received some funding for some of our programs from the federal government. And as part of that, we have a program evaluator. And so we are designing some specific outcomes measures with that program evaluation. It's only about halfway done, so I can't give you lots of that detail because we're midway through, but we use things, Connor Davidson resiliency scale, and then some different metrics that he has developed for us. So it's sort of from a combination of different things, but we really do rely on the PCOMs, the client satisfaction, and then with each funder, we have different statistics and things we have to report on. So we sort of compile all of that together. Yeah.
And actually, thanks, you know, it goes well into one of the questions in the chat that was commenting on, you know, with so many services provided, how do you get all the funding that you need to provide those services?
We apply for a lot of grants. We have some agreements with our provincial government, and they're with a couple of different departments. So whether it's Ministry of Social Services or Ministry of Justice, a lot of grants, a lot of federal funding applications go in, and then we have a bit of social enterprise. Like I said, that's partly what our EFAP is, so that money can go back in. And then of course we rely on donations as well. Yeah,
It's a constant.
Yep, constant.
Constantly
looking for funding. That is part of being in the nonprofit world, that's for sure.
Awesome. Well, again, thank you very much. We'll probably have a bit of time for questions at the end. So if there's any more questions you think of for Janine, pop them in the chat or raise your hand. But we will jump over to our last but not least speaker for today, Jamie Lewis, who is joining us from, sorry, Jamie, I just lost my little bio screen here. Here we go. So Jamie Lewis is the outreach advocate at Regina Transition House. As the outreach advocate, she provides ongoing support as women and families leave the emergency shelter and establish independence in the community. The Bridges of Hope outreach program aims to assist women as they move forward to live in a violence-free environment, which includes a weekly women's support group, children's programming, advocacy, referrals, emotional support, and crisis counseling and intervention. So thank you again so much, Jamie, for joining us, and I'm going to turn it over to you now.
All right, thank you. So as mentioned, my name is Jamie and I run the outreach program at Regina Transition House. So we are an emergency women's shelter. We've been operating since 1976. So since then we've been providing short-term emergency housing and services to over 14,000 women and children fleeing interpersonal violence. So as Janine kind of mentioned in her presentation, here in Saskatchewan, we do have one of the highest rates of reported domestic violence or interpersonal violence incidents in the country. And so for this reason, it's very important to have shelters and services that adequately address this need. And so when it comes to women in particular, they do have a unique set of needs and face a unique set of challenges in terms of finding shelters and the services that they need in particular. So, I mean, when it comes to domestic violence, it's important that facilities are secure. Finding shelter space that is safe and has room enough for women so that they can feel comfortable bringing their children into shelter. And then when it comes to finding housing as well, being able to find a safe and an affordable place that is able to accommodate their children is also very important. So those are some of the things that we try to address here. We do have quite a diverse client population from various backgrounds. We do have a large Indigenous population of women who utilize our shelter services. And so as much as possible, we do strive to provide a team of staff who reflect the diversity of our clients. We also have a very broad range of programs within our organization to be able to meet those needs. We've been working really hard on expanding our program areas, adding new programs in order to deliver a more trauma-informed approach and be able to provide sort of a broader support network for the women who utilize our services. So the main service that we provide are our shelter services. We are a secure facility that is staffed 24/7. So we have our domestic violence counselors. They're there 24/7. They provide one-on-one support for the women in our shelter, as well as they answer our 24/7 crisis line. So through our domestic violence counselors, we're able to provide one-on-one individual case planning. So we are very client-centered and client-driven. We are able to provide safety planning. We do a lot of domestic violence education, so women understand the types of violence, what violence looks like, various cycles of violence, and how to keep themselves safe. We do a lot of crisis counseling and support, emotional support as well. We do a lot of housing support too. So we try to address the various barriers that women face when it comes to finding housing. And we do a lot of advocacy work and referral to other community agencies, just kind of depending on what goals the women who come into our shelter would like to work on and what their needs are. So in addition to our main shelter program, we do have a children's support program. So we have children's support workers who work directly with mothers and their children. So they provide child minding when necessary. So they're able to make appointments and go out into the community and run errands and stuff if they're needing and not able to bring their children along with them. They're able to do advocacy and provide assistance with any kind of parenting supports that they're needing or concerns that might involve their children. We just recently started an addiction support program. So we're able to support women who identify concerns with substance use. We can work on sobriety and relapse prevention plans. We host 2 weekly addiction support groups. So we offer a group for the women who are in our shelter, as well as the women who are part of our outreach program. And so through our outreach program, which I am in charge of, I work with women once they leave the shelter. So we provide ongoing support as families move out onto their own. We do a weekly women's group, so we provide more children's programming. We have a teen support program as well. And our groups, we try to offer a wide range of programming. So we do lots of educational, therapeutic, cultural programming, and we try to address food security as well. And the group sort of just kind of helps create a little bit of a routine, helps create connections for women with our staff, as well as other women who are part of the program. So the final program that we have is one that we is fairly new as well. It was sort of born out of the pandemic. We have an emergent outreach program. So we were finding that with our limited shelter space, our wait list was getting quite long. And I from what I understand, that's still an issue with many of the shelters in the city and in the province, is that there's just a really high need. So this outreach program helps address the wait list and gets women access to supports and services prior to coming into shelter. Also helps women who might not be ready to leave their home situation, gets them access to whatever supports they're needed, and sometimes can even help them find housing without having to come into shelter, because that can in itself sometimes be a very stressful situation. So when it comes to ATTACH specifically, there are two sort of main challenges that we sort of have to tackle in terms of going forward with the ATTACH program, and that's really time and space. So we have our shelter is very short term, so our stays are typically around 21 days. So being able to have the time to offer the entirety of the ATTACH program as much as is needed. So if we start the program while in shelter, we'll have to kind of carry it forward through the outreach program. So there's just that factor of engagement. In terms of space, we currently have these sessions, they'll occur in our limited shelter space or at the client's home, just depending on sort of what space is available and sort of where they're at in the moment. Depending on where the family goes after leaving shelter, some women do choose to return to their partners or the living situation that they were leaving. So sometimes, depending on where they are, it's not necessarily safe for us to enter the home. So that's something that we'll have to work around as well. We do have more child clients in a year than we have women, given many women do come into our shelter with several children who may be in the age group that ATTACH targets. So I think in terms of how the ATTACH program fits into our organization and our programs, I think there's definitely a high need for it. All women who come into our shelter have experienced one or multiple episodes of trauma in their lifetimes. And so that does either indirectly or directly impact their children. So I think there's definitely there's definitely a high benefit for the ATTACH program with with the women who utilize our services. And then in terms of program evaluation and research, most of the data we keep supports our needs for funding and delivering services that go above and beyond the basic emergency shelter offering. So like I kind of mentioned before, there are a lot of unique needs more than just needing a physical shelter, which is why we have a robust list of programs. So that data that we keep really supports the need for that and then helps fund those programs and keep them running. And then finally, we do operate as a trauma-informed environment. We are constantly evolving and reevaluating in this area. So being part of being trauma-informed is addressing the trauma needs of the women and their children in a way that may prevent another intergenerational history of intimate partner violence. So those are kind of the main things that we strive for at Transition House, and how ATTACH can help provide a more well-rounded support for the women who come into our shelter and use our services.
Awesome. All right. I assume we're at the end of the presentation, Jamie. Just wanted to make
Yes,
sure.
thank you.
Okay. Thank you very much. That was great. That was great. We already have some questions in the chat, so I'm going to start with those. So great talk. Thank you so much. What would be the proportion of families you have that are parenting children under 5 in about a year? And then related to that question, have you seen intergenerational impacts with grown children being second-generation victims of domestic violence?
Okay, I don't know the proportion of families. I don't have that specifically. Most of the women who come into shelter have young children under 5. I would say it's a majority of the moms who come in, they have very young children. And then absolutely, we do see the impacts of second generation victims of domestic violence. Like I said, children are impacted either directly or indirectly. There's a lot of even if children aren't directly seeing violence happen, if they're hearing it, it's going to impact them. And we do sometimes have instances where we have children very young who are displaying sort of more aggressive behavior because it's sort of learned in the home. So that's something that we have to tackle as well. And it's something that mom definitely struggles with as well.
Do you see also though that like some of the women that come into your shelter when they were children, were they impacted by like, did they come from families with domestic violence? Like,
yeah, absolutely. Yeah, we have a lot of women who have very long histories of domestic violence, and it's definitely a cycle. That's something that we cover in our domestic violence education with women as well, to understand the cycles of violence and how it continues on. So the patterns that you learn from your parents on sort of modeling of relationships occur later on in life as well.
that's very scary, but yeah. And then another question, you were talking about, I think it was the outreach program for after the women leave the short-term shelter. Can you tell us more about that program?
Sure. So the outreach program usually lasts up to a year. It can be longer depending on sort of what's going on in a woman's life, how much support they're needed later on. So it does follow families a lot longer than we're able to in the shelter. We do all the same kinds of things that we do in the shelter. So any type of support that they need, we're there. And then we do our groups, which just kind of helps build skills, build relationships, stuff like that. So I think in terms of the attach program, most of it probably will be occurring in the outreach, through our outreach program, simply because our stays are just not long enough to follow that through. So
thank you. Excuse me, thank you. So we have 5 minutes left. So if anyone has any other questions for our speakers, please raise your hand or pop them into the chat. Again, I'm going to be a hug. I have one more question for you guys. So for Janine and Jamie, out of curiosity, like I imagine that there's a tension between the fact that you have very specific issues within a geography, you have very specific needs of a certain client, and yet at the same time, you don't want to be, so to speak, reinventing the wheel if you don't have to. So can you talk a bit, is there a tension between creating your own unique programming and maybe being part of an alliance or being part of this larger programs?
So we actually, both of our agencies are part of something called PATH, which is the Provincial Association for Shelters and Transition Houses. So that's mainly, but it also includes agencies like ours. So we don't operate a shelter. We do the counseling. But what the nice thing about PASS is it helps to reduce that. So you aren't duplicating, you aren't reinventing the wheel. You have a place to go to talk about. And the other nice thing is we can talk about issues that are common to all of us, right? Whether it be Clare's Law is a perfect example. So PASS did a lot of the research on Clare's Law, was able to be a common and coherent voice for all of us to bring that to the attention and get it actually did end up getting passed by government. And that was partly because PASS was able to collect all of the information from all of us, have a strong, united voice to then take it forward. And they're able to do that on a number of different fronts. So that is one of the awesome things of being in Saskatchewan and having PASS. And then I'll let Jamie speak to, there's also like a national shelter association, which I'm not as familiar with because we are not a shelter. So I can let her speak to that or add anything else she wants. But there are a couple of those things in our province to help us to ensure we aren't duplicating, we're working together, we're figuring out, hey, instead of doing this program, let's tap the shoulder of this person and do it together. So yeah.
As the outreach worker in my shelter, a big part of my job as well is sort of being the connecting piece. So I mean, we are very limited and we try to have programs to be able to address the needs that we see in our shelter, but we are very aware of sort of the other organizations that are doing sort of work in our area. And so when we do see or we identify a need or the client identifies a need, we're able to go, oh, okay, yeah, here's where you need to go. This is what they do. So there definitely is like a web of networks and supports that people are able to access.
Excellent, thank you. And I think we have time for one more question from the chat for all of our speakers. Beyond more funding, what would make it easier to effectively help your clients provide services or anything like that? I know funding's the big one, but beyond that.
I think having effective services. So for instance, the ATTACH program is a wonderful fit. Right? So it's not intensive time-wise. It was intensive for our counselors to become trained, but the actual implementation with our clients, like it's such a good fit. So it's trying to find more programming like that, where it meets clients where they're at. You can work with them, you can help them to see progress so that they don't get discouraged. You know, it's those types of things. And for us, a lot of that comes down to ensuring our counselors continue to do professional development training, right? Like there's just always new things out there. So it's being able to try those. And then it's just eliminating those barriers. Like for us, it's really important to be trauma informed, to meet clients where they're at. It's non-judgmental. So if they are in the relationship, then we do a lot of safety planning, which I think Jamie spoke to. If they're wanting to leave the relationship, we're making sure that's as safe as possible. But it really is to provide support to the clients wherever they're at. So yeah. Is there anything you want to add, Jamie?
I couldn't have said it better myself.
Thank you, that was great, that was great. All right, we are at 1 o'clock on the dot, so good timing on all of us. So thank you guys again so much for speaking with us, the ATTACH webinar today. We really appreciate it. Again, we've recorded this, so we're going to post this on the ATTACH Teachable website, so please feel free to tell other people they can go view the presentations there. In terms of last housekeeping, I'll be sending an email out about this, but we will not be having an ATTACH webinar in June, so the next one is going to be in September. So if you don't hear an announcement about that, don't worry, that's why that's happening. So yes, thank you again very much, and I hope that everyone has an excellent summer. Applause all around. Thank you, everyone.